Hi, Peggy. Hi, Bernie. Key West. Love that. Hey, everybody. I love it. Just waiting a few more minutes just to see who else is coming on to the live. There's Sandy, Lily, Pretty as They Come. I know you've been on before, Pretty as They Come. I can't remember what your name is. Hello. Constantina's here. Yay. Sarah. I love it. Just giving everybody a few more minutes to come on. We're right on the 7 o'clock hour. Hi, Tacoma. Yay. Probably too soon to feel anything yet, but I can't wait to hear how you're feeling. I love it. I love it. Let's see. Anybody else coming on? Hi, Heidi. Hi, Leah. Got my test kit today. Yay, Leah. I love it. I love it. I love it. So, yes, I'm excited for you two, Tacoma. So, they're talking about their test kit and their hormones, and Misty's here and Carol's here. Yay. So, these are our test kits. So, if you wonder what they're talking about, I don't want to leave anybody left out. But all you do is you go to our website, hormoneplus.com, or you can go to my link in bio. I know, Sarah, that is a long list behind me. It's very long. And when you order your test kit, all of those things are in here. So I always talk about this. Oh, yay, Heidi, I'm so glad. And yay, Misty got yours today. I love it. I love it. You guys are awesome. You know, I love it that you come here every night with me at 7 o'clock and you're becoming my tribe and you're inviting your friends. And there's Delia and new people. There's Sarah. Sarah, thank you for the rose. That's so awesome. And you guys are my tribe and you're spreading the word. And tonight is a very near and dear topic. And I'm going to get into it in just a second. Hey. Okay. So yeah, the test kit, little housekeeping here. Order your test kit, go to hormonebliss.com or my link in bio. And I always like to get the housekeeping out of the way. And that is from day to day, I don't know what's happening with this platform. And this is where my tribe lives. I stream on Facebook and Instagram, so I'm streaming over there. So if you ever see me look over there, it's kind of weird, I know. So you guys can always find me there. And all of the videos, you guys are always asking, when's the replay going to come up? And sometimes I don't get the replays up right away. But you can definitely go to my Facebook page, Dr. Tammy, and they are just kind of saved on the stream. So those are always there. So you can always go reference to those. And if you go to my link in bio, it takes you to something called a link tree. And I have tons of educational stuff. I have stuff about why my doctor told me I can't take hormones, which if you guys know me, you know how that goes all through me. And there's some weight loss stuff. There's liver, genetics, methylation, and sleep. Just so much stuff. But the main thing I'm telling you about that is, and my book is on there, so you can download free copies of my book. But the main reason I'm telling you is if anything happens to me here and you're looking for me here, if I have your email, and I always say, I promise I won't sell it or do anything weird with it, I can find you and send you emails and let you know where I'm at, or invite you to live Zooms. Like if you join our tribe and the Hormone Tribe, I'm there once a month taking questions and stuff. Live Zoom, which is really cool. So it's not just like this where I can only see your comments. We actually interact and talk. And so that's a much different platform. So love to get you guys in that group as well. Yay, Carol. And I think I'm actually a little overdue this month for our live, but we've had some hiring some new folks. And so we're having just a little bit of growing pains because you guys, I mean, it's nuts. I mean, I just see my little app blowing up with you guys ordering kits. So it just makes my heart so happy. And my goal before I leave this planet is that at least 50% of women understand what their choices are and know the truth. And so tonight is all about truth. Yay, Lori, you did your test this morning. Don't tell people how hard it is if they haven't ordered one yet, because it's not that easy to put all the slide in here, right? But it is much easier than trying to beg a doctor to do your lab. So much easier than that, and so much more convenient than doing that as well. So spreading the truth, getting at least 50% of women is my dream. And so as you guys share this and spread the word and the truth, it's so so important. My bestie just had stents put in and was under anesthesia on Monday. Should she wait to do the test? I don't think that should interfere with anything at all. Yeah. Oh, good, Lori. Glad you said it wasn't hard. Yeah. I didn't think it was that hard. I've done it many, many times, and it's just kind of like, it's kind of pain. You guys sit there and spit and then spit some more, but it's not that hard. Good. I just think of lemons, and then like it starts flowing a little bit. But yeah, as far as the stent, it's fine to go ahead and get them in. All the more reason, because the number one killer of women is heart disease. So we need to get her taken care of sooner rather than later, right? Okay. So I'm shifting gears just a little bit. We did all our housekeeping there. And as we're embracing what has happened to medicine, and I'm honoring how hard it is. My hormone bliss moderator, would you mind to step away for just a minute, because I've just had a small intruder, which is a little yellow cat. You want to say hi? She might be okay, but I think I will get him to come take care of her, because she will just sit here and cry and cry and cry and cry. But anyway, maybe she'll be okay. I hear him coming down the steps now. Okay, go on, come on, come on. She pushed the door open. Like, how smart are cats, right? Okay, now you met my cat. I actually have 4 of them. That's just one of them. So they're precious. I love them. But like, I know, right? My fur baby, Jan. I love it. Thanks for the mustache. That's awesome. Like, seriously, how did she open the door? I don't know how they know what they do. I mean, yeah, she is so pretty. I love her. So I have a Siamese, two, an orange and a gray long hair, and then I have a Russian blue. So they are super fun. But 4 cats is a lot, a lot, a lot. So if anybody wants a couple cats, I could ship them to you with your hormone kit. I don't think so. That's not a thing. Okay. So I'm going to get right into it, and I'm going to talk about what happened in medicine, and I think it's going to freak you out. Hey, Lucy, we're here to freak you out. Are you okay with that, Lucy? Do you have like a little bit of time for us to freak you out? The rest of the tribe, we are welcoming you. Hey, say hi to Lucy, you guys. Oh, thanks. Yeah, you know what? I promise I'm going to get to this. My fiance, his name is Mike. He's probably like, just get to it. Just get to it. But thanks. I ordered these on Amazon for like $20, and I just love them because they're like, it's a sweater dress, and so they're super, super comfy. So yay. Everybody saying hi, Lucy. I'm so glad you're here. Okay. So one of the problems, and what I have faced as a medical doctor over the years, I always tell people, in fact, a couple years ago, I was revealing some truths about this certain period of time that we just got through. And I was saying that there were some agendas that people were not aware of. And I won't go there because I like to stay on this platform so I can share with you guys. But I had so many people tell me, oh, no, that can't be true. And I would say you would not believe what I have seen in medicine. Someday when we have like a little time just to chat and have tea or something, I can tell you the story, but it'll probably get me kicked off this platform. So I better not. I've already been in enough trouble, but I've seen so much. I've just seen so much. So anyhow, I want to get into basically number one is why they told me my labs are normal when they're not. And I can tell you that I experienced that firsthand when I was in college. I was absolutely exhausted. I know you've probably heard my story before, my regulars here, but I went and I had probably $300, and that was 30 years ago, but $300 worth of labs done that I couldn't afford at that time. I mean, there was no health insurance back then. And I get this call from the nurse. You've probably had this happen to you. And it was like, your labs are normal. Really? Really? I mean, it's like, yeah, it'd probably be $2,000, Elaine. You're so right. I'm like, then why do I feel this way? And so that was my first introduction into, I didn't even get invited to a follow up with my doctor to talk about why I felt so bad. It was just like, you're normal. We checked, I had him check an ANA, which is an autoimmune thing, and I had him check, my kidney and liver and blood cell counts and everything. And that was no sample size of all the things that could be related to fatigue, just fatigue alone. And, my journey was basically changing my diet and taking some supplements. And that was so easy. But did that doctor or that nurse that called me and said, your labs are normal, hey, why don't you just clean up your diet and take some supplements? There was nothing like that. It was just like, we don't have anything to hang our hat on to give you what's called an ICD. It was 9 code back then. Now it's ICD 10 codes because they keep updating them. But we don't have a diagnosis code to throw a medication at you. So therefore, you must be fine. You must be okay. And I did not feel okay. And I had so many hormone problems going on. And I didn't know back then that I could even ask for my hormones to be checked. Not even a thyroid, because thyroid's hormone too, but I didn't even know to ask for my female hormones to be checked, right? Like our ovarian hormones. So I think we've come a little ways better now. But one of the reasons that we struggle so much, I truly believe, is that this is all of the symptoms of menopause. And like somebody just said a minute ago, wow, that's a big list. And this isn't even everything. But if you guys can bear with me just a little bit, and I always say when you order your test kit, there is a form in there that we have you fill out that we actually correlate your labs with this list. I don't think I can get it open. There it is. And all of these are on this list. So you actually get to fill this out and it's awesome. And it's just a little over $100. I think it's $129 and free shipping in the lab. And it's a totally free visit with our hormone coaches and they can talk to you. Lisa's filling her form out now. Yay! I'm so excited. That's awesome. So we'll kind of go through the list because Lisa's probably filling this out now, right? Okay, so I'll be quick, but I do want to talk about each one of these things a little bit. And you can only imagine, because a lot of women have some degree of all of these. And on this sheet, it actually goes through and it has 0 through 3. So you actually rate it. So the very fact that we let you rate it is saying that everybody's got something, right? So you give it a 0 and not many people have 0, but then up to 3. Sleepy all the time. I can sleep at the drop of a dime. Yeah. So fatigue, absolutely. Maybe not sleeping at night. So then you have fatigue in the daytime. So I'm just going to go through and I'm going to comment on each one of these. But you can only imagine if a commercial doctor, I call them, that has 5 minutes with you and their hand on the door gets this list. If they got this list, they would have a cow. There's no way they could even look at all this yet address all these things. So first off, agree. Yay, Connie. I'm so excited for you. Yay. You're so close to feeling better. I can't wait. Okay. So this is my little freaked out doctor, my artwork. Okay. So number 1 is fatigue. So that was very timely that you just said that you're so sleepy and so tired. Brain fog, because estrogen actually helps, not actually, estrogen feeds the vessels in your brain. And if you got no blood supply to the brain, that's a problem, right? So with fatigue, and you guys know me, I always have to draw this little graph. So 0 to 100, because we're going to look to 100 and feel like it. Our hormones, our ovarian hormones do this, and then they flatline. So pretty much I can say that everything that happens to you here is because you have no estrogen, progesterone, or testosterone. Is everyone sipping their tea? I have trouble sleeping through the entire night. I'm wide awake too. Okay, we can totally fix that. So progesterone is your main sleep hormone. So when we're talking about these hormones, we're definitely dealing with estrogen, progesterone, and testosterone right out of the gate. We fix that. We fix almost everything because that's what we're getting depleted in when our ovaries dry up. Thoughts on estrogen dominance going through perimenopause? I had 2 perimenopause patients in clinic today. And I'm like, wow. I mean, I was just like brand new patients. I mean, it was just like, because normally I get the menopause patients, right? So perimenopause is a little bit tricky because estrogen dominance, as things are fluctuating, because this is what happens during perimenopause. It's crazy. I mean, no wonder we're like losing our ever loving minds. But when we go through perimenopause, it is like just nuts. And so trying to balance that out is really tricky. The way you balance out estrogen dominance is progesterone. It's so easy. It's so easy that it's ridiculous, right? But you have to identify that that's what's going on so you can smooth it out. And a lot of times, depending on your labs, because everybody's different, we might use progesterone, we might use estrogen, or we might use testosterone. So just because you're estrogen dominant in like at 7 o'clock right now where we are, at 7:30, you might be dipped in your estrogen. So we can use combinations of things to smooth all that out and make the transition so much better. I am one of my patients today. She came in, and this is the way it goes with the medical system. So she comes in and immediately, thank you, immediately goes into her list of symptoms. And when I listen, I wait until they've gone through their list. And then I'll say, is that all? And they'll be like, yeah. And then we kind of go to this place where it's like, well, you listed all these things on here, so let's talk about those. And then we talk about those. And it's just like, we are so conditioned to just shut down and to almost feel like we're an inconvenience to the doctor, like we're an inconvenience to the system. And we have all this stuff because we're flatlined or we're perimenopause. And so because it doesn't make sense, because the fluctuation is so erratic in perimenopause, you feel crazy. And when you go in there to talk to them, you go in there with a mindset, this can't possibly be all one thing. But I always like to put all the things into one box because it is. And now there are still some things that are outside the box, but most of these things are happening because you have these hormonal changes going on. You could be born with a medical condition or cerebral palsy or something like that. So I'm not saying everything is menopause, but everything can be related to not having estrogen, progesterone, or testosterone. So that all has an effect. And I'm going to show you a picture here in a little bit how they all interact together, because I have to do some nerdy science. But when you're looking at these things, if a doctor saw a list with an intake sheet this long and they only have 6 to 12 minutes with you because they gave you a 15-minute slot, but 10 of that they have to go chart on you, and you have this, what are they going to do with that? And I actually remember one time when I was in my residency program, they actually conditioned us. They called it, you get one symptom, you get a pill for an ill. And if a person came in with a list, they would tell them they had to schedule another visit for that. So if you're giving them a pill for an ill and now you're having a side effect, and then you're just going to get a pill for another symptom that you have. And that's the way it was. We had to see 60 patients and we had to chart, and we didn't have, all this automatic charting and stuff that we have these days. It was written charts and then somebody would type them up, but it's clown world. It's absolutely madness. And I tried to work for hospital systems. I made it probably all total over my career. I probably worked for hospital systems less than 3 years out of my 25-year career. And it's not easy being in private practice, I'll tell you that, because there's a lot of responsibility as a business owner. But I can't play in that box. I cannot do that because it's such a broken system and it would hurt my heart so bad. And when I tried to do it, it hurt my heart really bad. So anyway, okay, let's talk about brain fog. Well, estrogen feeds the blood vessels to the brain, and brain fog is kind of connected. So some of these are interconnected with not sleeping, and not sleeping's down here. But constipation, or your bowels aren't working because you need that blood supply to make your bowels work. And then you start getting magnesium deficiencies because the system is out of balance. Sleep issues, chemical sensitivities. You used to be able to drink a couple of shots like you did partying when you were a teenager, and now you can't because you have a few glasses of alcohol and you just feel sick, or you drink wine and you get a headache, or smells bother you, or things smell funny. They don't smell, you're always like, that smells weird. What is that? Because all of those nerves are fed by estrogen. Bloating, gas and bloating. Your stomach is not working as well. The um, microbiome in your gut isn't working as well anymore. Blood pressure, estrogen actually, and so does progesterone and testosterone. But I'm just mainly focusing on estrogen. And I have to say, for you guys who are new here, that the study in 2002 that really misrepresented the truth. That's my way of saying they lied. Really, what's happening is that they dogged estrogen, and it was actually the progesterone, synthetic progesterone arm that had the data that was concerning. So let's just assume for a minute, if you're scared of estrogen, that estrogen is good, because when we're young and we're fertile, we need estrogen. So estrogen is not bad, right? So as we're going through this, I'm going to talk about estrogen a lot because it has properties that help elasticity. So if you have properties that help elasticity in your skin when you're younger, it helps the elasticity in your blood vessels. So you were talking about the stent just a minute ago. Why do we need a stent? Because we got calcium building up because we don't have estrogen to put the calcium in our bones. Now we're having strictures because the arteries aren't flexible. We have high blood pressure. It puts pressure back on the heart. So we have to reclaim our youthful levels. Metallic taste in my mouth. Yeah, absolutely. So if you've had, and I see this all the time, women who have had ovarian dysfunction their whole life. And so if you have that imbalance, what a beautiful thing when you get, into menopause and you finally find somebody that can give you some hormones, right? But it's really interesting too, because a lot of women think I have to wait till I have all these symptoms. No, get it during perimenopause. One of the girls I had today, she was 35 and she's like, I've been told I'm too young to be in menopause. I'm like, you're not in menopause. It's just a year without a period. If you're still having periods and you are in ovarian dysfunction, it's most likely perimenopause, which is the time before menopause. So it's a great time to get a handle on that. Joint pain, you need that blood flow that estrogen feeds those arteries to your joints. So frozen shoulder, I always say that because there's a ton of research on frozen shoulder and menopause. Attention focus. Do you feel like you got ADD like you used to could be able to, the brain fog, and now you're like, I can't even focus? Free book you can download. Rihanna, if you go to my main page where all my videos are, I think you click that little, my face up in the corner, my pretty little face, and it'll take you to my main page, and then go to it'll say the link tree, like link in bio, and then it'll take you to all my free downloads. And so it's there if you want the free download, or you can go to Amazon and buy it. There's a link to Amazon to buy it if you want to, but I mean, you get it free, right? And if you want the hard copy, I told everybody last night, if you will DM me, just pay for the shipping and I'll send you a free book too. So 24 years old and have a lot of symptoms, mainly dizziness. Yeah, so Dancing Jay, that's cute handle. Yeah, so it's got to be a hormone imbalance. It could be estrogen dominance. It could be anything. So we don't know until we test, right? So that's so crazy that you have to beg doctors to test. Seizures and MTHFR. Yeah, that's the methylation or the MTHFR solution. And I don't know if that one's on there. I'm not sure. I'll have to check on that. But if it's not, if you'll DM me, I will send you a link to that. So yeah, the methylation book. Yeah, I thought it was on there, but maybe my IT guy didn't put it on there yet. So okay, urinary tract stuff. So that can be infections, UTIs. That can be kidney infections all the way up from your bladder. That can be incontinence. That could be waking up several times during the night to urinate. Hot flashes. Everybody thinks hot flashes are menopause, but there's so many other things. And if you have thyroid dysfunction, you're not going to be hot because you're going to be cold hands and feet like thyroid. So that's just one thing on the list of all these things. If the only thing that if you beg a doctor to help you with your hormones. They're going to say, are you having hot flashes? And you might say, sometimes. And they're like, oh, you're fine then. Go on your merry little way. I'm like, but I have all this, but you don't have hot flashes. So it's nuts. Cycle, I feel so horrible. My PTH level was high. So that's going to be, if you're like before your cycle, probably estrogen dominance. And if you're dragging on into your cycle, you've probably still got too much estrogen. I think of it like those buckets at the water parks. They're supposed to just fill up a little bit. But if they fill up too much and they dump, then it's like it'll pelt you, right? So too much estrogen can definitely cause those issues. Um, and PTH level was high. So a PTH level, that's parathyroid hormone. That's the little glands that sit beside your thyroid. And a lot of times when you have a parathyroid problem, that can be because your blood vessels feed and your nerves feed your thyroid and your parathyroid, that you can have secondary dysfunction. So, and sometimes there's a little tumor. Usually they're benign, called parathyroid adenomas. Usually they're benign, but it's definitely something that you want to follow up on that, because it can make your calcium levels go too high, because now it's sitting in the blood and not in the bones, which is bad. So one of the things about estrogen is estrogen puts your calcium in the bones. So if your parathyroid is getting the wrong signaling, then you can absolutely have too much calcium in the bloodstream, and that's what happens. So important that estrogen regulates your thyroid function and also your parathyroid function. So, the underlying cause is what we got to go for. PMDD, yeah, that's what we used to call PMS, but it's just ovarian dysfunction. It's just an irregularity in your estrogen progesterone cycles. High 17-OH progesterone, 244. Is that congenital adrenal hyperplasia? It depends. Usually, the CAH syndrome is more something that we look for in like infants, but it can absolutely happen. It can cause some of the sexual formation problems as well. I actually have not ever dealt with that, maybe in my peds rotation like a million years ago. So if you want to direct message me, I'll do some research for you on that. The Dutch test, the dried urine test, has a breakdown of all your estrogen and progesterone metabolites. So any of you guys in our program that ever want to do that, we start with this, but once you're in the program with our coaches, they can help you order. Hi, Paula. Hi, honey. Yay, you're here. I love that. But once you're in the program, then our coaches can help you order the Dutch test or genetic test, whatever you want to do. So yeah, without really looking at all that stuff, I wouldn't know. Did your hormone test too? Will do is going to ask at consultation. Yeah, so if you want to do the Dutch test, absolutely, they can set you up with that. So it's a little more complicated to look at all those hormone metabolites. And so usually it's not really going to change things a whole lot, other than you can look at your cortisol levels, which then we can recommend supplements to you for adrenal issues. And then also, recommend other things as far as like we look at your melatonin levels. We can look at so many different aspects, neurochemicals. I mean, there's so much we can do with that. Yeah. So, okay. So let me get back to this. Anxiety, depression, mood changes, night sweats, neuropathy, that's just nerve pain, hearing loss, hair and nail changes, dry hair. There's these little things called bow lines that you can get, and it's sort of a line right across. It looks like I have them because I have French nails, but like a little line across there, and that's a metabolism thing from hormone changes. Ringing in the ears, weight gain, of course, especially around the belly, muscle loss because you lose your testosterone, heart palpitations because estrogen actually feeds part of the gut that has the microbiome that can trigger the vagus nerve. And then it's the parasympathetic system. So, I mean, your heart's going crazy all the time. And a lot of women go to the ER and they're told, oh, it's just heart palpitations. It's just a thing. And then if something really bad happens or they're having a heart attack, then they're like, oh, then they're just dismissed. So they don't even go. So I believe a big part of that women have heart problems is because now they've just been told, oh, it's just heart palpitations. And nobody ever told them was because of this. I'm on progesterone and testosterone cream now. Do I have to stop before I do the test? Nope, you can do it now because we can just see where you're at. And if what you're doing is working, clearly, if you did the test, then it's not working, but we can see where you're at. And I actually prefer that. So, and because it's a saliva test, it's perfectly fine. If you were doing like troches under the tongue or something, you would have to stop because it could interfere. But that's the beautiful thing about doing the saliva is that it doesn't like interfere with anything with the cream. So, but make sure you put on the form that you fill out that you are on the cream and the dosages so that we know that. Got the white thing in my fingernail. Yep. It's called a Bose line, Beaus. So yeah, that's and sometimes we'll see that from thyroid or if you've been really sick, like in the hospital or something like that. But it's part of menopause too. It's part of all that hormone decline. Okay, so fibrocystic breast disease, which is really just overgrowth of the breast tissue. And I know what you think. It's like, oh my gosh, well, why would you give me estrogen if I already have fibrocystic breast disease? Or I have women say, I had endometriosis and estrogen dominance. Why would you ever give me estrogen? It's about the balance. It's about estrogen, progesterone, testosterone, vitamin D, pregnenolone. And that's one of the things I'm really passionate about. We put vitamin D in our creams because the estrogen with the vitamin D helps put the calcium into the bones and not into the breast tissue. If you do a mammogram on somebody that has fibrocystic breast, it is a magnet to calcium and calcium deposits in there. And one of the things when we look on a mammogram that we know that it's scary, like a cancer, is it's called spiculations. So it looks like a starfish. It looks like something or a spider that's got all these little legs. And that is calcium deposits. And so you have overactive breast tissue because of the imbalance of your estrogen to progesterone. And so we want that balance. And we want to use the physiological, organic, matched up hormones, not synthetic, which is petrochemicals, which are a whole nother story. Go back and watch my other video if you're not familiar with that. I'm taking maca root and pumpkin seed oil. I would need to stop that before the saliva test. No, I wouldn't change anything because what we're going to do is help you based on what you're doing right now. Because if you stop everything, then it'll be like, where are you? Like we're going back to ground zero. Unless you thought that that pumpkin seed oil or whatever wasn't helping you at all. Maca is pretty cool. So it does help regulate your estrogen levels. But I would say don't change anything. Let's see where you are and let's make it better. Or we might even recommend don't do that, right? I don't blame you, Lucy, about not doing mammograms. I've always said, why would you radiate a healthy breast? That's just nuts. Now, and I'm not telling you to get mammograms. I don't want to be their girl. I don't be responsible for that. I absolutely do believe in self breast exams in the shower when you're wet. Make sure you cover everything so you have, good coverage, or have your partner do it. Hi, honey. But there's something called a thermography, and it can actually detect tumors up to 2 years before it even forms because cancers need blood supply and they can actually register heat where it's increased activity. And it can also pick up things like inflammation and stuff like that. But thermograms are awesome. They're almost everywhere. And why we don't recommend that, it's just crazy to me. And I was an x-ray tech before I went to med school. And it was like they would teach us that we're trying to come out with good technology because they call it a cone. And we used to have we would just blast women with tons of x-ray. And they would always say, well, it's no more than flying on an airplane. I'm like, you're freaking crazy. Biotin affect the results. Actually biotin, it can a little bit. Biotin can affect thyroid results, but thyroid and estrogen interact. So I would say don't change anything, but just make sure that you put it on your intake form that you're on that. It's possible I'm feeling better after the first pump of cream. You know what? Actually, yes, because it gets in your system, especially for acute things like hot flashes and stuff and sleeping. It's amazing. I mean, people are like, it's a game changer, which is so sad because women are suffering. And, it can take a couple of nights, but DCIS, I didn't see that question. So DCIS is ductal carcinoma in situ. I need to do a whole talk on breast cancer because there's so many aspects to that about the calcium and the estrogen and all the studies. So you know what? I think I'm going to do that tomorrow night. Would that be okay? Will you come back tomorrow night? I'll talk all about DCIS. I think it's overdiagnosed. I think it's become part of the cancer industry. Zinc can hurt your stomach. I'd absolutely take it with something else. Bring that question back up because I think I missed that talking. Um, are you in Dr. Tammy's program? Uh, Oh yeah, I think you're talking about, yeah. Is she doing that? Yes. Yes, please. Okay. All things breast tomorrow night. Bring your breast. Bring your brain. We'll study breast. So yeah, I love that. That's a great idea. Estrogen blockers. Yes, tomorrow. Yeah. Okay. I'll talk about estrogen blockers. Hey, honey, Michael, my bliss moderator, would you write that down so I'll remember that? Estrogen blockers and all things breast. Zinc makes me jittery and stomach ache. It could be the form. I'd make sure you eat breasticles. That's funny to come with. That's funny. Honey, make sure to mark down breasticles. um, but yeah, anytime something bothers your stomach, I get a different form of it because you can get, there's like fillers and stuff, like especially like the cheap stuff. So I would get a different form, make sure you eat something with it, or get it inside another supplement, like thyroid support or something that's got for a immune system thing. Ashwagandha Goli. I like ashwagandha. Some people say it doesn't do anything. I actually have one. Do you have yours in the store? I have a video, and it's I'm gonna mess this up. Shilajit, and I actually I do reviews for people. 10 Central, like Chicago, yeah. I do reviews for people, different supplements. So that I've got one that's a Shilajit, and it's very good. Cod liver oil versus vitamin D with K2. Um, yeah, cod liver oil is just a little bit different than vitamin D. So I tell people, I mean, it's hard to get enough vitamin D, so I do that. I don't have a zinc on my website. I probably should, but Constantina, we can do if you ask your coach, we can put a supplement recommendation together for you. And I have a website that has all the things, but they're all what are called nutraceuticals. So we have access to even just the things that I don't have in our store. High quality, it's called nutraceuticals. It's like a pharmaceutical, but it has all the high standard quality controls and stuff. Um, Yes, 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 Constantina. Yeah, we'll absolutely do that. I'm a huge believer in supplements. So I don't want you to like have your cabinet like full of stuff, but absolutely there's so many things that are really good. I don't know that ashwagandha is so important if we can get your anxiety under control, if you have that. But this one I have, like I don't remember how far down on my page feed it is, but it's pretty cool. I'll probably I'll do another video on that and share, and then you can order it on the TikTok shop. But okay, so more symptoms. So decreased libido, low testosterone, frozen shoulder. We talked about that. Thinning of your skin, where you start to see the veins pop up, and you don't have that good integrity. Burning mouth. You guys, somebody said that. Thyroid problems because estrogen and thyroid interact. Infections. Your immune system's down. Blood sugar, insulin problems, decreased lung function, cancer of any kind, really, acne, allergies, vaginal dryness, cholesterol changes, incontinence, tender breasts, addictive behaviors. I've had patients before that have told me that like they never like ever smoked in their life, and then they picked up smoking, or like in their late 40s, or that they never really liked gambling, and then like all of a sudden, so it's like just these weird dopamine triggers and stuff. Headaches, adrenal fatigue, skin wrinkles, that goes without saying because we need estrogen for our skin. Decreased stomach acid, so we don't digest our food as much. Leaky gut, weird dreams. I've actually had that more. I probably need to have my hormones checked because like my dreams have been really weird, really vivid, not scary, but just sometimes I forget to do that. I get so busy that I don't just like do my test. All the things, yes, I do all the things. bleeding, bruising, and vaginal bleeding, temperature changes, so hot, cold, back pain, fibroids, uterine fibroids, sluggish, exercise tolerance. You just feel, I call it magnet in the butt because you just don't want to do anything. Had some whoppers today, dreams. Yeah, yeah, crazy stuff. I mean, just like you're sometimes like if I do that, I'm like exhausted because I've been like looking for stuff all night long in my dreams or just I mean just the weirdest stuff, you know, I'm like I'm almost glad to be woke up because I was exhausted like doing all that stuff in the night. Mine too, blame the moon. Well, you can't blame the moon sometimes. Wasn't it just a full moon, I think? Yeah. Um, Heart attacks, we already talked about that, strokes, blood clots, burning tongue, decreased surgery recovery. I think we all know that. We just say as we get older. But the whole thing about as we get older is because we have no freaking hormones. That's not older. That's called ovarian failure. And that's why we start drying up and dying. Yeah, I know, right? Most of these symptoms, it's because it's menopause, right? A brain bleed a few years ago. So you never know with like some people have genetic clotting disorder. So I don't want to say everything, but it certainly contributes to a worsening of things because we don't see 30-year-olds having these problems that we have now. And that's when our hormones are tanked, right? So um, it was weird. Yeah, weird dreams are weird. Um, okay, so dizzy. Oh, and you know, surgery recovery. It's really interesting because all the methylation issues and stuff with the liver, because our livers aren't functioning as well. We're not converting our hormones, but a lot of people have a hard time with anesthesia. They're more likely to not be able to wake up well from anesthesia or not be able to, you know, they won't let you go home after surgery until you urinate or have a bowel movement. And so it's like everything stops and slows down because you can't process the anesthesia. So weird things like that, or hair falling out with anesthesia. Um, Breaking bones easily, that goes with the osteoporosis. So lots of things. I love you guys commenting. It makes me feel like you're hanging out with me and I'm not alone up here. Okay, board number 2. Why do you feel dismissed with all those things? Because it's a lot of things and it's all menopause, right? So the medical education gaps. It's very interesting because what we're up against too is, and I'm going to get to the bottom and I'm going to creep you out here by the time I get to this board. You know, I always have to creep you guys out a little bit. But the medical education gaps are, and I can tell you that when I was in med school, pharmacology was every semester was heavy, heavy, heavy with, I think it was like taking 32 hours, which like in college, a lot of people take 15 to 20 hours, right? So very intensive. The biggest part of it, yeah, we worked on cadavers. We did lots of things, physiology, pathology. Most of it was pharmacology. And I remember getting so overwhelmed, especially in pathology, which I love pathology. I actually did an internship for pathology. I thought I was going to be a pathologist, but I love all the things too much. So I love people and love patients. So, but yeah, so it's like, that was such a small piece. And maybe that's why I was attracted to pathology because it was like, it got me away from pharmacology a little bit. Estradiol patch or compounded creams. So estradiol patches are a little bit tricky. You also always have to use progesterone with them. So the patch and the pill. The nice thing though, when you do the creams is we can put it all together if you want. It's so much more convenient that way. And sometimes the patches, like you kind of get over estrogen a little bit sometimes. So it's a little bit tricky. So, but in our online program, which is how I get stuff out to everybody, and we can use coaches instead of using doctors, is that the creams are totally safe, they're bioidentical, and we can help get that out to so many more people. So if you want to come see me in Arkansas, we can do patches and pills and things like that, but this is the safest way to get it out to the masses. So but yeah, you're coming to Arkansas. Yes, that'd be awesome. Where do you guys live? I forget, you probably told me one night. Yes, come see me. Come see me. I love it. Okay. Medical education gaps. We talked about that. Symptom misdiagnosis. So if all those symptoms, coaches, so our coaches at, let's see, so our coaches actually talk to you when we get your labs, and they have all my protocols, and they're able to dose the creams. So you can't, oh, I like, cool, cool. So you can, you know, go get yam cream or something like that. But these are prescription strength, but you don't need a prescription for them, which is wonderful. We have a chemist that makes them. And so our coaches are trained by me. So you don't even have to see a doctor. You don't have to beg a doctor to do what we do. So it allows me to give tentacles to 50% of women before I leave this world, right? So that's the beautiful thing with that. Okay. Time constraints. If a doctor's only spending 12 minutes with you, oops, I knocked out my 12 there. 6 minutes, their hand on the door, you know, I mean, it's that kind of thing. Gender bias. So double standards in research. Guys get all the research. In Arkansas, I'm in Northwest Arkansas. Thank you. Oh, awesome. Okay, so yeah, Northwest Arkansas. So the double standard is that studies are often done on men because you can't really do studies on women because of the risk of pregnancy. So you can't use drugs and that could cause birth defects. So most of the studies are done on men. So getting research for women for menopause issues is, oh, you're so welcome, Dolores. For menopause issues is really hard. And then the research is often paid for by the pharmaceutical companies. So there's no unbiased there, but there's also bias in gender. Lack of studies and funding for women. Big Pharma is the system, and they kind of just go for the polypharmacy. And, you know, all they're really pushing in the med schools is the pharmacy. And then the side effects, and then side effects, they're treating the disease mode approach. I mentioned that a while ago. If you don't have an ICD 10 code, and they just don't do prevention, and lack of patient empowerment. So, speaking the language, I've always said that doctors speak Latin and it's very disempowering to patients. So, if you have a red bump on your hand, the language that they use is an erythematous papule. If you were to read your medical notes, you probably wouldn't know what that means unless you'd had some medical terminology or something. So you are very disempowered when you don't speak the language. It's like going to another country and they're speaking French and you're like, I don't know what they're saying. Or like if there's something dangerous happens and you're like, it's bad because you don't know what they're saying, right? And you're really at a disadvantage if you can't speak the language. And I always, when I do my charting, I say, you got a red bump, because I'm like, I want my people to be able to know, to be empowered, right? What's going on, which is why I do these talks, because I want you to have your power, because it's going to always be like this wall where gods are, or doctors are like these gods that, or think they're the gods, and they're set up in the system so that they're so much higher. My mom used to say, you know, like celebrities and stuff, we all put our pants on the same, one leg at a time, right? So there's really no mystical power that doctors have. Yes, it's a lot of training. It's very vigorous. It's exhausting. That's true. And I am not disrespecting that because I did it. And I know that the degree of time and blood and sweat and tears and all that. But as far as disempowering you, I just won't have any of it. I mean, it's not okay. This is your body. Lack of finding the root cause. That takes time. That takes listening. That's why our coaches have the time to listen. And they're sort of like my little parrots. They know exactly what I would say, right? So they need time to hear you, because so much of this is women feel unheard, and you deserve to feel heard. Your life depends on it. So important. Lack of understanding of basic endocrine systems. You know, it's like most of the time, if you get sent to an endocrinologist, it's usually for just diabetes or thyroid, and they're just going to stick you on meds. That's pretty much all that happens, unless you have adrenal crisis or something like that. It's pretty much they're not talking to you about the nerdy science of estrogen, progesterone, testosterone, pregnenolone, DHEA balance. I mean, it's just like, oh, if there's not a drug for that, it's not happening. Okay, now Um, let's play the scary music because this is the time when we go to the scary part. Cue up the scary music. Like, what is that? Deadpool? Cue up the music. Ooh. Okay. Medicine, dark side. Medicine wasn't always this way. Early in the 1900s, healing was very, very diverse. They used a lot of herbals. They used a lot of plants. Heidi, you're funny. They used a lot of plants. Doctors used to actually taste urine to see if it was sweet. Because if it was, you were spilling sugar in your urine and you might have diabetes. And so, like, yeah, I mean, it's like we are so out of touch. I know, Heidi, it's nuts. So, we're not doing that anymore. And please do not ask me to taste your urine. No, there's no way. Now we have strips and we can see. Um, they used to like just okay, I want to go there, but modern medicine actually followed the money because early in the 1900s, and I did not make this up, go look it up. I did not make this up, I promise. The Rockefellers were actually the oil barons, the petrochemicals. And if you watched my video the other night, I talked about synthetic hormones that they actually take petrochemicals, natural gas, they crack them, they break them down, distill them, and they make those synthetic steroid molecules. So they figured out that they could use their oil products, their natural gas, and those kinds of things, and make those molecules, and then stick a few carbon hydrogens on them and patent it, right? And then they could make all that money. The Rockefellers actually funded something called the Flexner Report in the early 1900s. So that's something you want to write down if you're going to study this Flexner Report. And basically, they created this plan where it was a pill for profit, basically, because that's what they were making from their petrochemicals were pharmaceuticals. And the very first pharmaceutical they came up with was synthetic birth control pills because they wanted something that people would have to take every single day, not just when they had an ache or pain, or not just when they had this or had that. They wanted you to have to take something every single day. And then they marketed the birth control in the 50s. So it took them almost 50 years to come up with something they could make you take every day. But so all of their medications are petroleum based. They had the monopoly, but what they did was when they started publishing this, that's when doctors who do what I do became quacks. That's where all that started. So the people who actually do functional medicine, who actually find the root cause, that's when it started. You know, if I say the word parasites, people call me a quack. But parasites are real. I mean, people get parasitic infections. Babies get pinworms. I mean, it's like you treat it, right? You have dogs and cats that live in your house, and we do antiparasitics for them. So it's like, but the minute you say that as a medical doctor, it's like, oh, she's a quack. Or the minute I say that I do bioidentical hormone creams, oh, like that's just weird. I mean, why wouldn't you use a birth control pill or something? I mean, it's just like it just goes there, right? So Flexner Report, and they actually defunded medical schools who didn't use their pharmaceuticals. And if you were defunded as a medical school, then what, right? So you had to play by these rules. So it's really scary. There are big pharma lobbyists in every aspect of our government. I'm not going to go there because I'll probably get in trouble. But I'm just saying a lot of money is changing hands, and you have got to get outside the box to find somebody to help you with functional medicine stuff. Okay, we're moving screens. I always tell you, I think I have 3 screens a night. Let's see if I can move this because I'm kind of out of room here. Yeah, let's see. Where are you? Okay, yeah, so we're going to do this. Okay. Right things seem wrong. Yeah, for sure. Okay. I don't know how much of this you can see. And I know we're running out of time, but I'm going to kind of go through this briefly. But the whole thing about, the whole thing about why the testing for all those symptoms that I had up a minute ago, it just takes time to do all that testing. So for the most simple thing, we do estrogen, progesterone, testosterone. That's the gateway in, and that fixes so much stuff. But, you know, a functional medicine doctor, A full thyroid panel includes quite a few things: T4, T3, TSH, TPO, TBG, reverse T3. That takes time for a doctor to do and interpret, to do your estrogen, progesterone, and testosterone at a minimum. And then they don't know what they're going to do with it because they're just going to tell you, oh, here's your sleeping pill, here's your antidepressant, right? So that would just take too much time. And sometimes insurance doesn't even pay for that. So doctors aren't going to do something because they're going to say it's not medically necessary. We're in ovarian failure. That is medically necessary. If you didn't have a thyroid, would they not tell you your thyroid hormone wasn't medically necessary? And yet our ovaries literally dry up after a year without periods. So yeah, it's clown world. You know me. I always say clown world. Vitamin D levels, iron levels, ferritin levels. I talked about hair last night. CBC, CMP, because low iron can make your hair fall out. I didn't finish that sentence. Your hemoglobin A1C, your food sensitivities, genetics, cortisol, DHEA, FSH, LH, all that takes time to understand and to order and to fight insurance companies to pay for it, and they probably won't. And then there's all this interplay between the pituitary gland in your head and then your thyroid and your pancreas making insulin and your adrenals making your cortisol and your ovaries making your female hormones and your liver converting all those hormones into their active form. So it's a lot, and doctors just aren't. I feel like, it's like way over here now. And doctors just aren't taught this way, right? We're quacks if we're taught actual physiology, right? And so then there's normal ranges. When you're told it's normal, what is normal? So if a lab's range is from 2 to 10, so the range is 2 to 10, and your normal is in the middle, but what if you're 2.1 and you're having symptoms and you're not feeling good? Is that normal? Why can't you say, I'm low normal? And why are we going to wait? Like you have a child in the street playing ball. Why are you going to wait until a car comes to say, get out of the way, right? So why not be proactive with this stuff? It takes time to listen, it takes time to order the test, it takes time to interpret. And it goes against the model. I mean, it makes you a quack. And natural functional medicine heals, and sick keeps you dependent, which is that's what feeds the hamster wheel. And okay, so here's just some weird facts. There are about 73% of all functional medicine doctors, which a lot of hormone doctors are functional medicine doctors because we want to look at the big picture, right? And there are less than 5,000 functional medicine doctors in the U.S. Now, some doctors do, lots of things, and that's not real easy to track. But this is crazy because there's over 1 million doctors in the U.S., and to just have 5,000 of those million, like, actually thinking like we think, right? I mean, that's nuts. And there's 20,000 GYNs in the US, which are supposed to be our female doctors that understand hormones. And there's less than 2,000 of that 20,000 who claim that they do specialized bioidentical hormone therapy. So they're really hard to find, which is why for me to have the mission that I have to get the testing in your hands, to get the information in your hands, to get the right blend of bioidentical hormones in your hand, to get your life back, get you feeling better, preventing disease, preventing all the things that are coming. Oh, that's sweet, Heidi. All the things that are coming your way if you don't take your power back right now. Oh, did you want to say my doctor? It was a quack. Yes. Yeah. Look up the Flexner report. That's where all that came from. I mean, before that, and I think there are a lot of doctors who do care, and they're very compassionate and passionate about what they do, but they don't realize what they're up against or what's going on and how they've just been bought out. And I have patients who have children who are physicians that think I'm a quack, and they're just like, I wish my daughter would think like you. And I'm like, they indoctrinate, right? They put us through like psychological warfare. They put us in these scenarios where we don't sleep for days on end. We're running codes. It's very stressful. And then it's very easy to just throw pharmaceuticals at people. It's much faster and it doesn't take as much work. Lisa, I love you. Oh, that's awesome. I love you guys too. You and my doctor. I love yes, thank you, thank you. Okay, so you guys have to spread the word. Tell your friends I'm here every night at 7 o'clock doing goofy stuff and hanging out. And I just, y'all are so precious to me. Oh, Carol, that's wonderful. So tell your friends to order a kit, get their saliva in the mail. Let's see what's going on with you, and let's get you feeling better. And like Tacoma said, was it Tacoma or Constantina? I don't know. One dose of some hormones. Your body is so hungry for them. So let's get them in and let's get you feeling better. So anyway, I know they're going to kick me off here because the time is up, but I do. I love you all so much. And come see me tomorrow.